So first I'd like to know, has nursing changed at all during this? And what have you seen in terms of your day-to-day job?
I became the chief nursing officer at the end of October 2019. So within 2 months, we were basically virtually into a pandemic situation. And I think that looking at nursing, you're really looking at the frontline caregivers in any type of, critical crisis situation. How we really have to look at our critical care areas and how we distribute care to all of our patients.
As a bedside nurse, I feel like a lot has changed for us in the way we can provide care. For example, we can't just run into a patient's room. If the patient is a COVID-19 rule out or a confirmed case, we have to now gown with our PPE or personal protective equipment. We can't just go into the room. When patients are dying, we don't have the family there. We have to use an iPad to Zoom or FaceTime family members so they can say their goodbyes. Just a few days ago, I had a patient who was dying, and I couldn't go in there and touch his hand with mine. I couldn't hold his hand. I was bound up with gloves on, so it's impersonal now. Like, I can't just, sit with my patient, hold his hand like I would in a different time.
The landscape has changed quite a bit, and our focus has been the COVID-19 patients and personal protective equipment, and really facilitating education for the staff, the bedside staff, how to put on and take off the ever-changing variety of PPE that we are getting in. And it's been a challenge, but I have to say that as a nurse, no matter what role I've ever been in, the morale is incredible, and the partnership has really taken off, and I think it's benefited everybody.
And we have the luxury here in the University Tower of having biocontained sections of our units. So the preparation that went into the planning for the biocontained areas, when the nurses are working over there, it lessens the amount of time that they have to don and take off their PPE and put it back on. They can go room to room, which is really much easier for them in protecting themselves and in dealing with their patients.
Talk about the ways in which you're still able to connect with your patients when their families are not allowed in the room. Have you found different ways that you're able to comfort them in such an uncertain and probably scary time?
So we've definitely utilized FaceTime and Zoom to communicate with families. We've also had several family members email pictures of the patient with their family, and we have them up in the room.
Not all family members had the technology at home to be able to connect with the patient and with the nursing staff. So we actually developed a room that is actually right off of our lobby that family members can come in, go into, and be able to communicate with their loved ones.
What would you tell people at home, or maybe whether it be advice, guidance, in order to help you continue to do your job safely?
Stay home. Definitely stay home. I know it doesn't seem fair to some people, but take this time to be with your families, stay home with your kids, go outside for a walk, but stay home, because the longer people abide by the stay home rule, hopefully the quicker this will all be over.